Good evening, ladies and gentlemen. Welcome to the 74th annual Hunger Games. Sorry, let me stop. No, welcome everyone to Secretary of Shade. This is a pretty special episode. Today we're going to talk about COVID-19. And the African American community, the Black community, Latino community, as well as Apple and Google joining forces. I never thought I'd see the day. I see you piling in. What's going on, Manny? How you doing? Cheryl's here. Kendra, what's going on in DC? Well, I know what's going on in DC, Kendra. They trying it over there. Kevin, what's going on? Thank you for the great message and words of encouragement, Kevin. I appreciate it. Sonny's here. Sandra's here. Barbara, what's going on in Philly, Barbara? We got a lot of wind here in Maryland and Baltimore, so it's like kind of crazy. But it's a lot going on in the world right now, as we all know. We're all starting to look a little bit rough around the edges. Shout out to Diddy, who is one of my greatest inspirations for having his revolt panel on COVID and the state of emergency as it pertains to African Americans as well. I thought it was dynamic, and I salute Puff for that. Hey Jamar, what's going on, my friend? Shanae's here. Oh, you guys are piling in. Okay, so I'm going to give you a few more moments and then we're going to get started. What's going on, Cam? Because we have a lot to... Oh, San Francisco. We have a lot to cover. I'm not going to lie to you guys. Just to start off with COVID-19 in general, it's definitely disrupted a lot of things and it has a lot of people on edge. But I feel like in real time... And I don't want to point fingers, but this is what happens when you have people in charge of governments who are not qualified. This is a prime example. And here's why. Because there's been a lot of misinformation out there. There's been a lot of confusing information out there. And it doesn't help when you have administrations who, quite frankly, don't know what they're doing. And this is why you should vote. Or pay attention to who you vote for, rather, because people definitely voted. But, and I'm personally a little nervous. I'm on edge. I am seeing people who I have had contact with just in life, not recently, but just in life, who have transitioned from coronavirus, and it's a lot to take in. And not just one, it's been a couple. And so I'm very scared. Let's first start off with this. In the beginning, like I said, there was a lot of misinformation, especially as it pertains to this virus and the Black community. Oh, Black people, for some reason, the infection rates are lower. And you have to be careful when you say things like that. Because let's think about it, guys. Me, you, the people who watch this broadcast or this channel, you know, we kind of keep up with this stuff. We looking at the articles. We're looking at the different information changes and developments and things like that. We forget that a lot of people don't watch the news 24/7. They don't have all of the apps on their phone. They don't even watch Secretary of Shade or my show. So, you have to be careful. The government, medical professionals have to be careful. Now, just to FYI, next Thursday, I will be having a special meeting on with people from the front lines, medical professionals, Black medical professionals, and their experience with this. I didn't want to do it today because it was so last minute, and I like to actually vet people because I'm not into bringing people onto something and then, God forbid, things go left or they speak and they're not informed, and then, that's a reflection of me. I always want to bring you guys good shit. But that was the misconception. You had people think, black people think, oh, I'm going to be good. I can keep going to work. I can keep doing what I'm doing. We good. Well, you're not. Okay? And, of course, I did some research right now as of this broadcast in the world. There are currently 1,684,833 confirmed cases of COVID-19. Out of that, 375,499 have recovered. 102,136 have died. And the out of that, 498,563 cases are from the United States. 28,580 of those have recovered. And 18,516 people have transitioned out of this life. Now, you heard those numbers. The United States numbers, 498,563. Now, I went and I looked at some of the major cities, some of the hot spots of where the virus is breaking out the most. And this is the correlation between the percentage of black people that live in the city and versus the percentage of deaths, okay, of black folks, of African Americans, people of color who have died from coronavirus. So let's take Chicago. 30% of the population is black. Out of the cases of deaths from coronavirus in Chicago, now mind you, only 30% of Chicago is black. 70% of the deaths have been African American, when it's only 30%. 30% of the total, we're only 30% of the total population in that city. Okay? In Louisiana, 32% of the population is black. 70% of the deaths are black people. Let's take a look at Mississippi. 38% of the population is black. 71% of the people who have died are black. Like, I mean, looking at these numbers, I find it crazy. Okay? Now, what is interesting is this. When I look at these numbers outside of the Midwest, when you look at the South, okay? The South and the Midwest, in Alabama, 27% population is black, 54% of the deaths, of the total coronavirus deaths are black, okay? When I look at this, first off, now we gotta dig. Now we gotta unpack this. So, when we look at those amounts of deaths versus the population, okay? Especially in the South, all right? There's a reason for that. Now, mind you, a lot of our, I'm of a certain generation, so I will go to the doctor. But for the age group that they say would be most impacted by the coronavirus, as far as it being a fatality for them or fatal, most of our elders do not like to go to the doctor. And it's because they don't trust them. A lot of older African Americans have a real problem with healthcare. And if they do trust them or they do go, Medicare ain't shit. Our healthcare system is trash. Okay? And so you have these people who, first off, elderly people or people who may not watch the news 24/7, first hearing, oh, we should be good. Black people have a lower rate. They're not really catching it. And I'm paraphrasing, but that was the general synopsis that was given out. Okay? So these people are staying home. They're not seeking care. They're thinking, okay, I'll be fine. And they're dying. Okay? Now, let's also look at this. when you think about working from home, okay? Now, I'm fortunate. A lot of my friends that I know, a lot of my music business friends, a lot of my people who work 9-to-5 jobs as well, have the ability to work from home. But when you look at the African American community, a lot of the African American community represents a lot of service and hospitality jobs. Okay? So you can't necessarily Skype in as a bus driver. You can't Skype in the bus, bitch. You can't Zoom into the hotel. Okay? You can't, remote in at the jail. Okay? Paramedics, CNAs, things like that. Okay? You can't necessarily work from home from that. And social distancing, you might as well forget it. It's hard to social distance on a goddamn public bus. And there was a gentleman who actually, and I'm quite sure most of you saw, there was a gentleman who posted a video on social media, I believe, where a lady had coughed on him, and he died from coronavirus in like 2 weeks. Okay? And that is scary. And I'm also thinking about all of those people who have children at home, who are going to work every day, and then coming back home, being in contact with these kids. Who knows? They could be transferring it to their families. Uber drivers. And a lot of these jobs, these essential jobs, someone pointed it out, I was going to get to that, but a lot of these essential jobs, black people work. They can't remote in. My mom is actually considered essential. She works at Hopkins, and she's considered essential. And my mom's not a young woman, love her to death, nice lady, beautiful gowns, but she's not. I mean, she's not a spring chicken. So I do worry about that. My stepfather has respiratory issues. These are things that you have to think about in regards to that piece, as far as that. Also, too, pre-existing conditions. I know a lot of people, talk about this, but I have to think about it in this way. Like, watching this go down, watching this unfold, I'm a hefty honey, okay? I'm plus size, bitch. He's up there. I'm worth the wait, okay? And as much as I joke about my snacks, I yo-yo up and down because I do suffer from depression from time to time. And we're not even going to get into access to mental health care, okay? Because when I'm depressed, I eat. And when I get depressed, I don't eat celery and shit, bitch. I'm going to fucking Little Debbie, Marie Calendar. I got all them bitches on speed dial, okay? But now this is making me think maybe I should revisit my mental health as well, because if I don't fix the mental health, it's still going to contribute to my physical health, which I'm fortunate that I have health insurance that I could possibly work through these things, okay? A lot of people, especially people of color, do not have access to mental health care. So if you are an emotional eater, or you don't have access to certain things, and Taco, move. You don't have access to certain things, okay? You're not going to eat the best. Also, too, if you're not able to make a living where you can comfortably sustain yourself, okay, pay your bills, and eat sensibly, most people are eating to survive, okay? They're eating to survive. So I can't go and get the salmon all the time, salmon high. I can't go and get, asparagus noodles or whatever the fuck it is all the time. I'm buying things that are going to make sure my kids are full at the end of the evening, and that's going to last. Most of those items are high in salt, high in sugar, high in processed. They're processed. The sodium's out of this world. What does that contribute to? Diabetes. Okay. Respiratory problems. Asthma. Okay. All of these conditions. So guess what? All of those underlying factors, when Miss Corona shows up, she's taking your ass the fuck out. And it's made me even think about my eating habits and what I'm doing. And, I got on the exercise bike. I got this little phony ass exercise bike in my apartment. I got on that bitch today because I was like, look, Miss Rona, I personally feel like I need a better death. I don't do mass death. God willing. I mean, if it's my time, he gonna take me. But I just feel like I deserve a little. I don't do the group thing. Okay, I'm very much a solo artist. I don't do the group thing. Okay, just kidding. We have to find laughter in these moments. But these are all things you have to think about. And as it pertains to social distancing, I was reading an article in India, and I have a lot of friends who are from around the world. I have friends who are Saudi, friends who are from Eastern Europe, all around the world. And when I sit and talk to them and they describe some of the living situations, and when you're dealing with an event like this, it's hard to social distance. Okay? It really is difficult. And what I found was, okay, if I am making under $40,000 a year, I have a family to support. I have to feed this family. Okay? My home's not going to be that goddamn big. Okay? So it's only going to be but so much space. So even if someone in that home gets sick, the likelihood of infection for everybody that lives there is going to skyrocket. Okay? Now, you can eat better and things like that. We can take strides, we can work out and things like that. But those things take time. You can change them now, but as it pertains to this immediate crisis now, we screwed. We can turn it around, but it's like the ding ding ding, the ding ding, the ding ding ding. The bells are going off, and I think that it's very important that we take care of each other. Call and check on folks. Even if you gotta Zoom and do a morning workout together, something bullshit. I don't care if it's Donna Adams, the British guy that's been all over Twitter from the 80s. Naomi Campbell does a workout on her Instagram that I think is hilarious, but it's effective. Okay? That's a good one. Javon said the corona is the canary in the coal mine. Absolutely. Absolutely. I couldn't have said it better myself. I wish I had thought of that. But it's definitely affecting us in a way. Now, the thing is this. The only thing that I feel like we can really do is be precautious, do everything that we can to stay healthy. Because the reality is the answers, the information changes so much every day. Okay? The answers change so much every day that we don't know. And the only thing we do know, stay your ass in the house. Okay? Am I still here? Can you guys see me? If you can, make a do a little waving. Somebody said they messed with the glitch. Okay, wave. Okay. Alright, so you guys can see me. So, I would say, go ahead and make sure that, you stay healthy and do what you need to do. Now, What is interesting in all of this, just to segue, is that Apple and Google, which is something I never thought I would say, Apple and Google are joining forces. Okay? They're joining forces. And by the way, they're late. They're late. I just want to go on record because what I'm getting ready to read, China's already doing this. You're late. But okay. Apple and Google are joining forces. So this is from Vox.com. It's a website that I absolutely love. They have really good information, very reliable, and fact-based. So, I'm going to read you some of the article. Just when you were wondering why the world's biggest tech companies weren't doing more to fight the coronavirus pandemic, Apple and Google made a big announcement. They are joining forces to build an opt-in contact tracing tool using Bluetooth technology that could help public officials track the spread of COVID-19, the disease caused by the novel coronavirus. The new tool brings with it not only hope for a quicker end to the pandemic, but also a host of privacy and security concerns. The contact tracing tool Apple and Google want to create will have your smartphone log when you come into close contact with other people. If one of those people later reports COVID-19 symptoms to a public health authority, your phone would send you an alert. It works a bit like exchanging contact information with everyone you meet, except everything is designed to be anonymous and automatic, allegedly. Instead of contact info, your smartphone will periodically exchange anonymized tracing keys with nearby devices. Both devices maintain a list of the keys they've collected on a cloud server. And when one person reports an infection, they have the option of sending an alert to people they've recently been in contact with. That alert will share information for what those people should do next. Those are the broad strokes of what's sure to be a very complex public health-focused surveillance system. It represents an unprecedented partnership between two competing tech giants, one that could forever change the way our devices talk to each other. Apple and Google say that the new contact tracing tool will work between iPhones and Android phones. So, bitch, all this time, y'all been acting like I can't hook my motherfucking iPhone up to the goddamn PC. Y'all been doing that shit just to get the money. That shit was never true. Y'all could have been did this shit. But that's not important right now. I just want to point that the fuck out. Okay. The Bluetooth-based approach also draws on beacon technology that's already in use in retail environments and is already a concern for privacy advocates. Understanding the privacy and security implications of this new coronavirus contact tracing technology will take time, but based on what we know now, the tool will start rolling out soon. Okay? So this is scheduled, the first phase of the release is scheduled to start around mid-May. And I want to talk about this a little bit. Here's the thing. You're late. Okay? You're late. Okay? In the LGBT community, there's a saying called late. Okay? Meaning that you're not up and up. You're late. China has been doing this. This is late. Okay? It's late. Alright? And I don't have all of the details on the Chinese version of what the fuck they trying to do. But the reality is this. Yeah, I'm not against it, but it's a few things in this that concern me. And believe it or not, it's not the privacy. Bitch, Facebook, Twitter, Instagram know all our goddamn business anyway. So at this point, nothing is private, bitch. If you took nudes and you call yourself putting them in a hidden folder or saving them in the cloud, guess what, bitch? Your ass is on Entertainment Tonight. Everybody knows your shit. So I'm not, the privacy shit, fuck all that. My concern is this. The person has to send out a beacon. They have to put that in. Now, we know everybody is not going to report. Now, even though this is saying it's anonymous, some people not going to report that they got corona, bitch. You know what they're going to do? They're going to go home in their house. They're going to be quiet, hopefully recover from this shit, and move on. Okay? So we got to trust that people actually report this stuff for this to even work. Based on what I just read. Maybe I missed something. But we gotta like, I'm just saying. For some people it is going to be an issue of privacy, and I'm not against privacy advocates. I think that it's important, but seeing what's going on, and even though they're using, be clear, it is not lost on me that this public emergency and crisis is not also being used as an opportunity for certain people, certain companies, and certain entities. That's not lost on me at all. Okay? So, for me, the fact they're going to do some backhanded shit anyway. That's going to happen whether we like it or not. Because I know that that's going to happen. My concern is depending on people to do the right thing to actually hit the button and be like, bitch, I got corona. That's my whole concern. So we shall see how this works. So the first phase is supposed to roll out with it. Google and Apple will release the API so that public health authorities can then build apps that will be publicly available in the Apple Store and Google Play Store. People can choose to download those apps, and again, these apps will let iPhones and Android phones talk to each other. The tool's second phase will roll out over the next several months. Apple and Google plan to build contact tracing functionality into the operating systems of the phones themselves, which might sound a little tricky for folks who worry about being tracked without their consent. As the New York Times pointed out, by building the tool directly into the operating system, Apple and Google effectively ensure that the contact tracing system can run 24 hours a day rather than only when a particular app is open. I feel like I'm starting to see the effects of lobbying. If we're gonna talk government real quick, I'm starting to see the effects of lobbying and lawmaking and policy and bills and all of those things, because why does it take so long to do these things? It's so much red tape. Yes, the website is Vox, VOX.com. I feel like, yes, China is China and they are what they are, but when it comes to their tech, they whip our ass. We are not number one. They had this shit up and running like a month ago. Into working. They talking about months. People gonna be dead by then. And that's no shade. Like, people gonna be dead by then. As long as this rollout takes, and then we depending on an app, but then some of them might have the software. It's just this is a lot. And then you're gonna have to have the people update their phones to get. I get it. I like it. Kinda. But Jesus. I'm just saying. But I feel like this. It's all of this is a lot. Okay? It's a lot. And looking at that, and then looking at how this virus is affecting black folks, it's just like a lot of information out here, which is why I like to read the information, but I don't want to just become a data bank with this broadcast, with these meetings. I like to simplify it because it's so much data you can get bogged down, and you start to lose track of what's what. Okay? Someone brought up to me, they was like, well, you should bring specialists on it. I said, that's what CNN does. That's what Fox News does. That's what MSNBC does. And guess what? Most of you tune out of them. Okay. So at this point, I would say just follow standard safety precautions. Continue to wear your mask. Stay 6 feet away. And hopefully soon this will come to a close. Because the reality is we don't have the answers. Nobody really has the answers. We keep getting different answers. And I would encourage folks to not do gatherings. Especially in the DC area, Maryland area, I've seen some stuff on social media that I was like, I can't believe it. Be mindful of our folks that are incarcerated. And I know you may say, well, they're in jail. They're still human beings. And just because a person is in jail doesn't mean that they're guilty. And it doesn't mean that they got there correctly. Khalif Browder. That's all I'm going to say about that. So I send my support and my empathy to people who not only are incarcerated but also work in the jail system, because jails are not really clean. They're old, and they're not. A lot of them aren't in good condition. So I send my sympathies to those folks. And as you all know, Easter Sunday is coming up. I didn't think I was going to touch on this, but I can't tell you what to do with your faith or what to believe, or that's not my place. Okay? That's not anybody's place. I do hope that for those of you, and I've been seeing this online, that plan on attending these Sunday services, that you use the caution, that the utmost precautions. Part of me as a man of faith myself, I get it. I'm not going on Sunday, faith or not. I'm not gonna run into the punches. Okay? But I would encourage you to please exercise caution, not only for yourself, but for your children. No matter who you may believe in or what faith you practice, just please be careful. Please be careful. And if you are a pastor, bishop, priest, deacon, deaconess, prophet, prophetess, Mitchell and Ness, please, take your position seriously, because we don't want that death toll to keep rising as well. So please use caution. But that's pretty much it for tonight's broadcast. You may be seeing me tomorrow because the Clark Sisters movie comes on tomorrow night. I will be doing my famous live commentary via Facebook, bitch. So get ready for the post. Turn on your alerts, bitch, because we get ready to go in. And also, too, some of you have been asking me. You asked me, and I want to address this. Have been asking me, DDM, I want you to read. You don't read to us. And the reality is, I haven't been reading because it's so many political books and so many books like that, because that's how this whole situation started, that a lot of it is just fluff and a lot of it is noise to me. And I have to be able to stomach that and also think about what I'm promoting, okay? In regards to that. So I am going to read. And some of you may not join me. Some of you may join me. I am going to read. But I want to read something fun. It's one of my favorite books. One of my favorite autobiographies. The person whose autobiography it is has since passed away. But I am going to read. I'm going to read chapter starting probably, I want to say Tuesday. I would love to do it Sunday, but we'll see. I know Easter Sunday is Sunday, and people are kind of like in their judge, and this book is kind of bangy. But I do want to read again. So with that being said, starting on, fuck it, we can do it Sunday. We can do a chapter Sunday, right? Comments Sunday, reading, chanting, you know, something. Too many shows on Sunday. So okay, so too many shows on Sunday. So give me a thumbs up in the comments if Sunday is good. Give me a thumbs up in the comments if you want to wait until Tuesday. Yes, no, maybe so. Yeah, so yeah, Tuesday. No, yes, Sunday reading. Okay, so yes, Sunday reading. One, yes. So put the day in the comments, guys. Tuesday. Okay, we got one for Tuesday. Sunday. Okay. Sunday. Somebody, yeah. Which day, Ash? Tuesday. Okay, we got one for Tuesday. Both work for me. Okay, Doris. Both work for me. Sunday. Okay. So we got a lot of folks saying Sunday. Chelsea, how you gonna vote twice? You already said Tuesday before. Melanie said Sunday. Okay, so Sunday it is. Okay. So what we're gonna read is something lighthearted, fun, it's shady, and it's hilarious. I'm gonna read one of my favorite books, Glow, the autobiography of Rick James, with David Ritz. Okay. This book, he talks about Prince, early Prince. He talks about a lot in this book. And we're going to read a small portion of it on Sunday evening. I want to say Sunday at 7. And then we'll pick up on it on Tuesday. So we'll read like maybe the introduction and maybe the first chapter on, well, the introduction is kind of long. Let's see how long the introduction is. Okay, so the introduction is pretty lengthy. So we'll read the introduction and one of the first chapters because it's pretty short. But that is going to be my official selection that I'm going to read because I need something that's going to take my mind away because we cover a lot of the reality anyway. But we are going to be reading Glow, the autobiography of Rick James. And you know how I read, bitch. So this is getting ready to be a key, okay? I think this book might be out of print. There may be some copies still on Amazon. And this is going to be Sunday at 7, between 7 and 7:15. This may be out of print, but I'm not sure. Insecure don't come on till 9, sis. So we doing 7. Insecure is what? Okay, Insecure. Okay, we doing this at 7 anyway. So this is Sunday after dinner, and then we watch an Insecure moment. But we are going to read Glow, the autobiography of Rick James. I think this is going to be hilarious. I think it's a great selection, and I have not forgotten about you in the readings. So go ahead and get excited. This weekend, Insecure come on Sunday. Yes, it does, but it doesn't come on until like 10 o'clock. I'm doing this at 7. But that's what we'll be reading. Because I do have quite a few books. But so I will see you guys Sunday at 7 p.m. We'll go over the intro and the first chapter of the Rick James book. If you're watching this on YouTube, Westworld comes on. All of these shows that y'all are talking about, let's be clear. All of these shows y'all are talking about come on at 8 o'clock, 9 o'clock, or 10 o'clock. They do not come on at 7 o'clock. I'm just saying. Okay? But if you haven't already, make sure you hit the bell at the top for notifications if you're watching this on YouTube. Also, make sure you subscribe to Secretary of Shade. Also, make sure you follow me on social media at Dapper Dan Midas on Twitter, Instagram, TikTok, the whole shebang. Until then, you guys have a great evening. Be blessed and happy Easter. Good night.